We're going to get started in just a couple minutes. We're going to go ahead and get started. Thank you all for joining us for our Massachusetts Oral Health Equity Virtual Summit. This was originally planned as a one-day in-person event, but due to COVID-19, we've moved it to a series of weekly virtual presentations. So this is our third in our series, and we encourage you to watch all of the previous ones. They have been recorded and will be posted, so we'll definitely share those. And feel free to come back for the next ones as well. So my name is Kate Hamden. I'm an epidemiologist with the Office of Oral Health here at the Massachusetts Department of Public Health. Today, I'll be the moderator for our two presentations focused on community health workers working in dental care and a second presentation on dental care for the LGBTQIA+ community. So to start with a few housekeeping items, everyone has been muted upon entry to minimize background noise. So if you have a thought to share or a question to ask, please put it in the Q&A box. Note this is a little different than other webinars. We're asking you to put in the Q&A box, not the chat box. That's located at the bottom of the window. We will moderate those questions at the end of the presentations in the last 15 minutes or so. This webinar is equipped with a CART reporter who will be doing closed captioning. To turn on the closed captioning, hover over the CC icon at the bottom of your screen and click Show Captions. These presentations are also being recorded and will be shared and posted on the MDPH Oral Health Equity webpage. If you are looking for CEs, or if you signed up to receive CEs, you'll need to be present for the entire hour and a half presentation. And you'll need to complete the evaluation that will be emailed out once the presentation has ended. And now, before we jump into the presentations, we have a few poll questions so that we can better get to know who's in the virtual room. So I'm gonna, actually it's just one poll question. So I'm gonna launch that question now. All right, looks like most people have responded. So I'm gonna go ahead and end the poll. Looks like we have a lot of dental professionals, some medical professionals, a lot of health educators, some school nurses, community health workers, early intervention providers. So definitely a mix of people. So thank you all for joining. So now I'd like to jump into the presentations. I'd like to first welcome Tu-Ha Lee and Nellie Plasencia, who will be presenting on community health workers' experiences increasing kept dental appointments through the Oral Health Equity Project. Tu-Ha, through her own personal experiences and coming to the United States as a refugee, has long been an advocate and supporter of community health. Tu-Ha received her Bachelor of Science degree in Community Health from Worcester State University, and from there she went on to be the first executive director of the Southeast Asian Coalition of Central Massachusetts. Her work has been recognized with the Women of Consequence Award presented by the Office of the Worcester City Manager. Tu-Ha went on to receive her master's degree in Community Development and Planning from Clark University and subsequently joined Family Health Center, where she is currently the manager of health education and community outreach. And Nellie Plasencia has worked as a community health worker at Family Health Center of Worcester over the last 6 years within many community outreach and education programs. Nellie received her Associates of Science at Salter College and trained as the leader of chronic disease self-management programs. Growing up and working closely with her community, Nellie developed a passion for community health, and she has become a strong advocate for her patients' needs. She utilizes her outreach and education skills to help her patients improve their self-management and better manage their chronic conditions to improve their quality of life. Tu-Ha and Nellie, you can go ahead and get started.
Good morning, everyone. My name is Tu-Ha Lee. I am currently working at Family Health Center of Worcester as Manager for Health Education and Community Outreach. And also here with me today is Nellie Plasencia, CEO, key community health worker in this project. So Nelly, would you please share the screen so people can see our slide? Nelly, are you there? I'm sorry for the...
Hi, good morning. I am here. I am sharing right now.
Yes, please.
Okay, I believe we are good to go.
Okay, next slide, please. Okay. Our objective for the presentation today is to share with you the partnership building between the dental department and the WIC program and our community health worker outreach program, and how we develop our program workflow and how that workflow works. We will also share with you the success, the challenges that we face, and also the lesson that we learned throughout these projects. Before I dive into the OHIP program work, I would like to introduce you to the Family Health Center of Worcester and its works. Family Health Center established in 1972 and is all operating at the Rimmery Care Patient Center Medical Home. Hold on, Nelly, go back to the first one. Okay, yes. And to meet the demand of outpatient services, in 1991, Family Health Center of Worcester moved to the former Worcester City Hospital at 26 Queen Street, where this is how the OHIP program currently operated. Next one, please. Family Health Center Worcester is a federally qualified health center. Our mission is to improve the health and well-being of all residents in the Greater Worcester area, especially culturally diverse population, by providing the access to affordable, high quality, integrated, comprehensive, and respectfully remedy care health care and social services, regardless of the patient's ability to pay. And our team, it comprised of more than 400 medical, dental, other clinical provider, pharmacists, nutritionists, interpreter, a health benefit advisor, and community health worker. Our services, we provide outpatient care in different, like 55 different languages. And about 46% of our patients are best served in the language other than English. And we have our internal interpreter team to address this need. For patient insurance, our patient consists 60% of them have Medicaid, 11% of them receive Medicare, 16% of them have private insurance, and about 12% of them are uninsured. And 94% of our patients have a low income, the income level below 200% of poverty, and 75% of them live below 100% of the poverty. So we in the area with not a lot of need. Our services, we provide our services in 16 satellite sites and Queen Street. The one in Queen Street is served at our main location. At Family Health Center, there are many programs and services available for our patients. In the academic program, we train physicians, nurses, dentists, optometrists, and social workers. We provide integrated behavioral health on all of our medical care team, urgent care. We offer counseling services and early childhood behavioral health. In our radiology department, we have a digital X-ray lab and mammography. HIV, OBAD program, refugee health, prenatal care, are part of our special population programs. Since last July, we took in the homeless outreach and advocacy program we call HOPE, adding it into our many other existing programs. We embed our school-based health center into 7 schools in Worcester. And we also have in-house the pharmacies, dental care, and vision care. For support services, we have a health benefit outreach and enrollment program. We have patients apply for health insurance directly at our center. We have a whole department working on that. We have patient advocacy and navigation, interpretation, SNAP enrollment. Patient can apply for food stamp right at our center too. Wellness program, exercise program, and we also have a community health evidence-based program, education program, provide CDSMP, diabetes education program for people with chronic condition. And also we have a new patient orientation monthly for new patients who enroll to the care so they learn and they know about existing services available at Family Health Center. So we start with oral health in Massachusetts in 2019-7, DPH start on that. And according to the Mass Health Statistics report in 2019-7, over 278,000 children did not receive dental care, which is about 44% of the children eligible for mass health. That is why oral health was chosen as the focus of the project. Recognizing the need to address the issue, the Oral Health Equity Project started with 3 main goals. First, we would like to develop the Healthy Inequity Profile and Community Engagement Plan. Second, the next goal for us is to increase the number of Black and Hispanic children up to the age of 14 years old with the access to the dental home. And the third goal is to disseminate the results and develop the statewide oral health equity plan. The workshop today that you are participating is a part of dissemination the result of the project, and we will share with you more results later on in the next few workshops. Why in Worcester? We asking the question, and everyone may ask that question too. First, Worcester is the largest city in the state without the community water fluoridation. As you can see in here, the percentage of the Black and Hispanic children under 14 did not have the dental clamp, and they are higher in Worcester and Holyoke in comparison to the state average prior to this project. For the low-income children, these 2 cities are geographical hotspots in Massachusetts for inadequate dental care. As you can see, in Worcester, we have about 30% of Black children do not receive a dental care compared to 9% in Massachusetts. And 21% of the Hispanic children in Worcester compared to 12% Hispanic children across the state. So that is why Worcester was chosen one of the cities to address the dental health equity for the children. We all know that integrating community health worker model into the medical care was successfully advancing the health equity across this disease area by providing outreach, education, navigation, support, and help family address social determinant of health issues. However, the community health worker model have not been frequently used in a dental care setting. So we decide to adopt this model and pilot in our oral health equity projects. And to be able to achieve the oral health equity project second goal of increasing the number of Black and Hispanic children up to the age of 14, accessing to the health care and finding the dental home, the DPH department with Family Health Center in August, we partner together to address the oral health equity in Worcester. And at the same time, Family Health Center department at that time already have a system in place to receive the referral from the medical care team for the children who need the dental care. We also have a direct referral from the school-based health center, the one that work under Family Health Center. However, due to some of the restriction from the WIC program referral system, because they use in the WIC program, they use the totally different system for their patient care, and Family Health Center use different EHR system. So both systems not be able to communicate with each other, and we cannot be able to send the referral directly to the system. So through that, we identify that this is the place for us to use the community health worker outreach to improve the access to the dental care for this population. And with that idea, we then reaching out to the Worcester WIC director, Wan Nguyen, and we also coordinate the meeting with Dr. Sullivan, the dental department director, to discuss about the need, about the resources, and also to develop the workflow that work for both programs. The project received a strong support from our leader due to our mutual benefit. Now, I want to share with you how we develop our workflow and what our workflow look like. In the first 2 months when we start this project, the DPH team, we have a very strong, work very closely with the DPH team. So we work with them and with the Family Health Center OHIP team, which include the representative from the WIC program department, with the dental department, and with the community health worker outreach department. So we meet together and we develop our program workflow. The medical care team, as I mentioned with you earlier, that, and also the school-based health center, because they will be able to send a referral directly, so they work with their patient, they identify the patient who need a dental care, and send the referral directly to the medical record. And in case of the case of who need emergency dental care, they can make the phone call and we can be able to book the emergency dental care on the next day appointment or on the same day appointment if we have a space available. But for the WIC program, we develop the different system. We have to develop the referral in the paperwork and paper form. So the staff from the WIC program, from the WIC program can be able to use it to refer their patient to our dental program. So with that in mind, with that leadership in mind, with the model of our workflow, the community health worker team in the next follow-up month working directly with the WIC team and attend the WIC program monthly team meeting, and we work with their whole team and develop another workflow for the referral form, filling out the form, screening the patient, or build that in a screening process for the WIC program. When they screen the patient, they can build the workflow into this screening process to be able to identify the children who need a dental care and do the referral. And we also work to identify the time, the schedule for the community health worker to be able to come to the WIC program and be able to do outreach in person in the WIC program during their working day. So next, okay. And now, when we work in the WIC program. When we work in the WIC program right now, let me let Nelly share with you the work that she do personally at the WIC program, so you can hear directly from her how it works. So Nelly, please join us.
Thank you, Tuha. Good morning, everyone. My name is Nelly. I'm the community health worker for Family Health Center, like Tuha introduced me before. The OHIP CHW pilot program, we started our outreach program on a regular basis. We started 2 times per week to be able to speak directly to parents while WIC complete their daily referrals through the intake. The intake takes a 2 process, which gave us the opportunity to start meeting the family in between that process. On the CHW outreach, I focus on counseling parents about oral health, dental needs, and any barriers for social determination of health that the family might need. At the same time, we assist them at the moment in between the process that they do one-on-one while waiting for the WIC appointment and connecting with staff as well. We collect data information, we schedule the follow-ups, and provide the referral feedback in a routine schedule for the meetings. After our outreach is completed, we work with a workflow as receiving the referrals of the week that the WIC office has completed. Those referrals, we do not meet face-to-face with the patient right away. We meet them after, but we complete the referrals by contacting the patients, mainly 3 days within the time of the referrals being completed, to kind of build that relationship between the parent and the patient and be able to assess any needs, barriers, like transportation, any hour schedule or days that they need. We work that with the dental office as well, as we pass the referral after for them to get contacted for the appointments and follow up. So I'm gonna pass this to Tuha now so she can talk to you guys a little bit more about the enrollment data.
Hi. Okay. So right now I want to come back and to share with you what we learned, what the result of our program, and share with you what our success and also our challenging too. As you can see from the slide here, that from August 2017 until March 2020, prior to the COVID issue, our community health worker outreach and provide early dental care information to almost 1,100 families. These are families with children under 5 years old because they are in the WIC program. So through that outreach, we enrolled 368 children into the program. As you can see, with those enrolled into the dental care, 125 of them are Black and African American children, that consisting about 34%. And 161 of them are Hispanics and Latino. It's about 44% of our patients that we enroll. And we have about 82 children from other ethnic groups, which mean people who speak Arabic, who speak Vietnamese, who speak Nepali, different languages, Portuguese. It's many different languages that we have in Worcester, because Worcester is a very diverse. We have a very diverse population here in Worcester, so it is considered about 22% of the total of children that we enroll. And with the 368 cases, 194 cases were referred to WIC program staff that they work with them during the day. They recruit patients and tie them up and refer them. And 74 children recruited directly from the community health worker outreach in person when they are in the WIC office. And with the strong partnership and the extra effort from both programs, we have achieved the goal of increasing the access for African and Hispanic children in the dental care in Worcester area. Now you can see in here another key finding that we have for this project. In the dental care team, our dental care team worked very hard to schedule more patient appointment, make it more available. We even dedicate a special time during the week, just for the WIC program patient, because it's very difficult. As you can see, it's very difficult to like have space available for the dental appointment. Sometimes people have to wait for a long time to get that. So with this project, we try to set a separate schedule each week for the patient, any patient who enroll to WIC program, so they can be able to access to dental care earlier and sooner instead of wait for months. So that is what we do. And you can see during the period of the time that we have it here from October 18 to July 19, the children who African American have increased 2% of the people who have appointment schedule, and the percentage of the Hispanic and Spanish speaking children at the same level, 28% during this time. Okay. And now I can share with you another key finding that we have in here. Prior to the project in August 2017, the no-show rate were estimated to be about 35%, which we found it consistent across Massachusetts Community Health Center Dental Department. And the same thing too, prior to the project, between 35 to 50% of the book appointment were kept. That means the people who keep appointment. And since we start the intervention and we do more outreach and more effort with the community health worker involvement, we see the increase, about 70% increase for the children who keep appointment. And at the same time, it turned out to be equally 7% decrease the appointment with no-show rate. So for the fiscal year between 2018 and 2019. So as you can see, with the effort, between a lot of effort between the dental team, the outreach team, and also the WIC team, we learned that with all that effort, extra effort we have, and the model of the community health worker working in the project, it really have improved the percentage of people who keep appointment and lower the no-show rate in the dental care team at Family Health Center. Now, with the next for key finding, we find in here that the no-show rate average for the children under 7 years old is higher than the no-show rate for the older children. Many different barriers for the parent who with young children. So right now we can in the last year when we review our data, the children no-show rate is ranging between 19 to 23. That already improved from the beginning when we have about 35%. It already improved between 19 to 23%. But we feel that something there we can do more. So we looking for different strategy, how we can be able to improve more because the need and because that we want to see how this project is success if we do more. So during the last month of 2019, we create another strategy to do the outreach. So we run the report for all the patients who have appointment schedule, and we call them, the community health worker call them 1 week before they have their scheduled appointment, and to do the reminder, and also to address any barrier for them to come for the appointment. And with that, they also receive another reminder robot call 1 day before the appointment. So when we trying that, we see the big increase of the decrease. We saw the big increase of keep appointment and the big low decrease on the no-show rate across all age trend. Because that when we call all children between who have appointment up to 14 years old. So we call everyone, not just the weak patient only, but everyone. And right now, in March, when we in February and also in March too, the current no-show rate that we have in our department is 13%. So with that, when we do the phone call, we learn from the parent that so many of them forgot the appointment because they have so much going on. So they forgot the appointment. So they really appreciate for the effort that we call a week of time to remind them, so they can make sure they have it, they mark it in their schedule to go for the appointment, and also address any insurance or any barrier that they have before they come for the appointment. Okay, so now also at the same time right now, I want to show you another key finding we find in our program. This is just specific for the children who in the WIC program. We see that the keep appointment rate for the young children that we enroll to the WIC program outreach, it increased from 39% to 43%. As I mentioned with you earlier, the children who are younger age have more no-show rate and lower rate of keep appointment. But you can see right now between the December of 18 to December 19, we see the increase, 4% increase for the children who schedule for the dental care, dental appointment, who keep the appointment. So that the reminder call for the kid in this program and the relationship and the connection between them and the community health worker, it's really working. Now I would like to turn it to Nelly so she can share with you specific lesson learned that she have in working directly with the family and with the children to enroll them into the program. Nelly?
Thank you, Tuha. The lesson learned honestly in this situation is that we have learned that communication and relationship between the parents is very important at this moment. Sorry about that, the camera. It's very important to us, as we can share the same culture and we can share the same language with parents. At the same time, we follow up with them, like I said before, 3 days after receiving the referrals. We make sure that we can communicate. We can know if there's any barriers, like I said, transportation, insurance, any questions that they need, or even the barrier of being afraid to go to the dentist, or what age they can bring their child to the dentist. We build the relationships by communicating to them. We build the relationships by those appointment reminder calls. Sometimes we give an appointment reminder call a week before, which is what we started doing last. We started doing the weekly appointment reminders, and the family were very proud. They were very thankful to letting us know. Thank you for reminding me. I didn't even remember. Scheduling dental appointment is very difficult sometimes because they get scheduled way ahead of the time that they need to get. They get scheduled within months of the appointment. So the patient's parents really don't remember when that appointment has been scheduled. Then out of nowhere, they get this 2-day robocall that they need to figure out how to get to that appointment. And that has become a barrier with a lot of the patients. But they're very thankful receiving that phone call because they're able to plan ahead a week of the appointment to be able to attend the appointment and not become a no-show. By providing that 1-week phone call, I think it has increased a lot of numbers. I think it has helped us a lot to manage the dental appointments and also communicate with dental departments if they need to reschedule that appointment, so that appointment don't become a no-show for that family. Also, one of the barriers that we become a lot is enrolling siblings and family members that need that dental care, because they don't know, or that we provide that information and education to the family for the dental appointment coming up, or also a parent has a question about another sibling, and that sibling doesn't have a dental or did have a dental in the past time and needs one now. So I think that communicating with the patient has become a big lesson learned for all departments and family health center, because that communication and relationship that we have built through them has helped us a lot through this program. I'm gonna pass this to Tuha, but I can't hear her. So,
Okay,
okay, thank
I'm
you.
here now. Okay. So I will share with you our learning lesson to the partner communication. And as I mentioned with you earlier, that strong relationship between the leader and the mutual benefit, it really have the program moving forward. And also with the weekly follow-up between the community health worker staff and with the week staff also have addressed any barrier regarding to the referral, lost contact, anything that we need to work with, it's very helping out. And also the community health worker, we do the monthly meeting with the dental care team, so we can address any like schedule appointment, address any barrier between the referral process and schedule appointment. And with that, and also uh, den, the dental team and also the WIC team, and so be able to improve the number of kids who enroll into the program. So the communication is very a key piece for us here. With the next one, Nelly, the next one. Internal communication communication is also key too. As I mentioned with you earlier, that one of our we have monthly, weekly meeting between the community health worker team and a monthly meeting with the dental team. So it helps us address any barrier that we need. And one of the dentists who share with us that they see, she mentioned, we say that we continue to see the enrollment from siblings, especially on the age after the tiny teeth appointment with the younger sibling. The involvement of the family at the unit have alleviated the phobia usually associated with dental appointment. The early outreach and education set them up for the better dental outcome as they get older, so that you see our dentists very appreciate the work that we do and feel the benefit of the work that we do. Now, almost the time I have my slide here just to share with you that the sustainability, what planning and how we can continue the program when we end up the funding and when we don't have a community health worker to do the work. One of the planning that we are doing is to build in the system the way that to make it easy for the WIC team to send the referral for the dental team at family health centers to be able to schedule their patient appointment. And we will strengthen the internal referral between the school-based health center and the dental department to address the children care dental need, not just when the emergency care, but it also in the routine dental care too. Um, we also know that the community health worker role is important to address the health equity. However, their job is still not receive any reimbursement from insurance yet. So we totally depend on grant to care for the team. So we actively looking for funding and to at the same time working with the DPH at the state level to advocate for the community health worker job reimbursement. And to the COVID, right now with the COVID and with the new telehealth system that everyone try to work on right now, we hope that with the telehealth, we can be able to offer more intervention education to family and in turn improve the quality of health for the children. And so that is my part of the presentation. I would we will have a question and answer. If you have any question for me, please put it in the box. Then later on, at the end of the next presentation, we will answer any of your question. So now I would like to turn it to Kate. So Kate can take it from here.
Hello, everyone. Thank you, Tuha and Nellie. That was really excellent. I'm just going to... Couple questions. So for Tuha and Nellie, Hugh Silk asks, are all of these efforts for referrals to Family Health Center of Worcester Dental Department, or are they for Family Health Center of Worcester Dental Department and outside dental providers? And if you are working with outside dental providers too, how do you help families to find local dentists?
I can answer that question. Based on the program that we decide, Nellie it only work with the patient who connect from the WIC program to the dental department at Family Health Center. At the WIC program, they have many resources available for parents who want to choose the dental home for their children. They have a lot of flyer and brochure. They have a board. They have a list, and they have business card from different dentists around the area. Place it in the WIC department, with the waiting room. So parents have the choice. If they want to go to Family Health Center, then they place a referral to us. And if they don't, they have many other resources that the parent can go to. And for Nellie, the same thing. When she mentioned she meet with parent and she talk with the parent, depend on the parent choice. A lot of them already have a provider, dental care home for their children. But anyone who don't have a dental care yet, then we talk about the services we have available at our Family Health Center. And if they interest, we take them. Not all patients who come to the children who come to the WIC program going to Family Health Center. They have many different choices.
I think it always depends also on where the patient needs to be or what's the barrier of not coming to Family Health Center. It depends why they're not able to accept the referral or the information we're giving them. So there's a lot of barriers when it comes to that, including the transportation part for social determination when we are speaking with the patient as well. So it all depends on what is the problem, why they're not able to join us at Family Health Center.
Great, thank you guys. Another question for both of you is, on average, how many encounters, navigations by the CHW are needed to achieve patients arriving for dental appointments?
Yes, I answered that one earlier. I did let them know we don't have a number. We don't have an encounter or navigation limit. I think that we set ourselves to do at least 3. Yes, we set ourselves to do at least 3 outreach calls, but I tend to not give up easily when it comes to the patient. So I always tell outreach to them. I always try to find out why they can come to the appointment. If they previously have come to a dental appointment, and try to get them to the appointment to make it not no-show or cancel appointment. So we always try to do as much as we can with the patient and figure it out to keep that appointment kept.
Great, thank you. And then this was just a comment, someone wanting to make others aware of the Smiles for Life curriculum. It's a free online curriculum of modules specifically for community health workers. So go check that out if you haven't already. Another comment. Awesome. Well, we are at time. So thank you all. All those presentations were excellent. I learned so much. So before closing, I just wanted to thank all the speakers again, as well as the attendees for taking the time to listen and ask questions. Next week on Friday, June 5th, starting at 11 a.m., we will continue our Oral Health Equity Virtual Summit with presentations on oral health equity in Rhode Island and oral health care during pregnancy in Massachusetts. And finally, before we close, just a reminder to complete the evaluation. It's going to be sent out right after this in order to obtain your CEs for your time participating in these presentations. So thank you again. And there was another question that had come up previously about when the recorded presentations are going to be shared. All of those will be sent out at the end once all of the presentations are finished on June 12th. We'll send out all the previous recordings. So thank you all and have a great rest of the day.
Have a great day.
Bye.
Thank you, everyone.
Thank you, everyone. It was great.
Thanks, everyone.